Hello and welcome again to King Mash Show, where we create a positive impact both to your health and lifestyle. So today we are going to continue with the topic of antenatal clinics, and as I promised last time, we are going to be checking on what do you expect in each and every clinic. So we are going to check on ANC visits. So it's more of a repetition in almost most of the visits, but we are going to check specifically ANC visits. So most important is the initial visit. That's the first visit. And as we said in the previous video, we said you should go as soon as you know you are pregnant. As soon as you know that you are pregnant, you should start your clinics. But if you're planning for your pregnancy, it's good you start it before. We call pre-antenatal visits. You go and plan with the doctor. They help you to maybe time the gender. If you want to calculate for the gender, they want you to get some enough and adequate folic just before you get pregnant. So you can start before. But now, if you didn't manage to start before and you just found yourself pregnant, these are the things to expect when you start your antenatal visit. So in your initial visit, you usually do the vital signs, very important vital signs. And as we said, the vital signs, it will include your blood pressure, your weight, your pulse, respiration rate, and temperature. But of most important in this, they'll check on your blood pressure and weight. These are well recorded because we monitor how you progress and just to know if you are getting into any danger or such stuffs. So you'll see most of the time they keep a good record of your BP and your weight. And according to the booklet or the tool that you use, you'll see there is a record and prognosis of the same. The next thing, after they have done the vital signs, they are going to check on a comprehensive history. A comprehensive history will involve a lot of things. In comprehensive history, they will need to know about your family. Do you have a history of twins? Do you have a history of diabetes? Do you have a history of hypertension from your family? Do you have a history of chronic disease like tuberculosis? And then they will need to know you as a person. How are you? Have you been suffering from either comorbidity? Do you have a heart problem? Are you asthmatic? Do you have TB? Do you have diabetes? Do you have hypertension? They need to know how is your health condition? How is your social life? Are you a drunkard? Do you smoke? How regular? Are you ready to seize it during this pregnancy so that they can know how they will help you? They're going to check what's your economic status. Do you have an insurance to just plan for the delivery and such stuff? So it's a comprehensive history of how you are, what's your belief, what does your religion take about this? Does it have some implication that you should not do this in your pregnancy? You should not do this, so that we can understand you as a wholesome and know how they guide you throughout the pregnancy. And also after that, now they take the present history. When did you experience your last menstrual period? How did you start learning that you're pregnant? Are you vomiting? Do you have headaches? They try to see on the current presentation, how are you doing as a person? Because every pregnancy is different. They also ask you, have you been pregnant before? What was the outcome of the other pregnancy? Was it good? Are the babies still alive? And such stuff. They help us a lot to just know what are the risk factors you should be having or you would be having as a mother in this pregnancy. The next thing they check is your general assessment. We call it physical assessment. So what is entitled in a physical assessment? They will check first on your general look. How do you look? Are you well kept? Are you clean? Is your hair well combed? Do you look presentable when you're coming to those clinics? They do check your eyes. Do you have any problem? They check on your cornea just to see, are you pale? Do you have any comorbidity that could be turning your eyes to be yellowish, which could indicate a liver effect or such stuffs? They check, do you have swelling at any part of your body? They check, how are your breasts? Are they good? They'll do your breast examination. Do you have any lumps? Do you have any alarm that could be a risk factor, like risk for cancer and such stuffs? So they'll do physical exam from head to toe. They'll check on your head, they'll check on your neck. Do you have any tonsils that are swollen or such stuff? They'll check on your breast, they'll check on the stomach. They'll palpate just to feel, do they feel something or like of an ongoing pregnancy? They'll check your hands and legs. Do you have any swelling that could be as a result of poor blood flow or such stuffs? So they'll do a comprehensive assessment. They'll ask you, do you have any discharge down there? If there is need be, they'll supervise. Do you have any discharge? Do they need to do some screening for cancer or such stuffs? So those are the things that they'll do on the physical exam. Another thing which is very important, they'll do a HIV test, counseling and testing. So they'll do a HIV counseling and testing for both couples. They check on both of you, they'll advise you. Why we do HIV is just to protect the unborn baby. If you know your results earlier, you're going to advise you how to stay safe with this baby. The thing you'll note in the subsequent visits, after 90 days from the initial HIV counseling and testing, we repeat again for the couple again. For the same reason, just to know if you are at any risk, and they give you adequate prophylaxis or adequate medication to prevent your baby from contracting the disease from you if you are positive. And also, there is a special treatment or special clinics we do for pregnant mother who are HIV positive. It's very different from what we give to these other mothers who are not HIV positive. Even for the supplement part of it, there is a supplements that you'll be given more when you are HIV positive, and it's not given to the mothers who are not HIV positive. So they'll do a couple counseling and a HIV test. Then you'll do a lab test. There are a lot of lab tests that they will do. They'll check on what's your random blood sugar. They'll check on your HB, that's the hemoglobin level. How is your blood level? Because when you're pregnant, you get some hemodilution. We need to know you need enough blood to supplement both you and the baby. They'll also check on things like VDLL. VDLL is an indicator of an sexually transmitted infection, especially syphilis. So they'll do the VDLL just to check, do you have this sexually transmitted infection? Because if you have them, then they will cause some risk to the unborn baby. They'll check tests like urinalysis. Do you have any urine infection? Do you have protein in the urine and such stuffs? They'll also do some other. There are many tests they'll do. They'll do your blood group. They'll do your blood group and research factor. Again, this is very important. They would want to know what blood group are you. Are you blood group A, B? Are you blood group B? Are you blood group A? If you are blood group A, they will check on your research factor. Are you research factor positive or negative? Are you A positive now? Are you A negative? Why we do this is because if you are any research negative, may it be A negative, B negative, O negative, or AB negative, you need to get the anti-D. That's an anti-research factor jab, which prevents you from having subsequent reaction in future pregnancies. So they will do the research factor, which will protect both you and baby and their future pregnancies. So if you are research factor negative, then you get the anti-D. That's some expectation, and you'll be getting from the first visit when you get these research factor vaccines. So thank you so much for listening to this. In case you have any question or you would like us to discuss something that you didn't understand well, please feel free to inbox or comment there below, and then I'm going to address it in the subsequent videos that we shall be recording. So thank you so much, and let me see you on the next one.